Are you ready to have your mind blown about the seemingly innocent vegetables in your fridge? What if I told you that some of those nutritious greens you've been dutifully adding to your plate could actually be sabotaging your health? Especially if you're over 60. This information could be a game. Share for your well-being. In this eye-opening video, we're about to reveal 9 vegetables that seniors should absolutely avoid. These aren't just minor irritants. We're talking about veggies that could be spiking your blood, sugar-worsening arthritis pain, or even interfering with crucial medications. You might be shocked to discover that some of these healthy foods have been silently wreaking havoc on your body for years. Some vegetables may cause spikes in blood sugar, contribute to kidney issues, or aggravate conditions like gout and arthritis. Others can lead to bloating, indigestion, or interfere with the absorption of important nutrients. But here's the kicker. We're not just going to tell you what to avoid. We're going to arm you with the knowledge to make smarter, safer food choices that could dramatically improve your health. Are you ready to find out if your favorite vegetable made the list? Stay tuned, because number 7 might surprise you. Let's chat about 9. Veggie seniors should think twice about eating a common and vibrant ingredient to many recipes. Bell peppers are prized for their strong antioxidant and vitamin C content. These seemingly innocuous veggies, however, can have unanticipated health consequences for elderly people. The primary issue with bell peppers is that, particularly when eaten raw, they can cause heartburn or acid reflux. Compounds in bell peppers, especially the green kind, have the ability to relax the lower esophageal sphincter, allowing stomach acid to reflux up into the esophagus. Seniors who already suffer from gastroesophageal reflux disease, GERD, or other digestive disorders may find this uncomfortable. In addition, bell peppers are a member of the nightshade family, which also includes potatoes, eggplants, and tomatoes. Alkaloids, which are substances found in nightshades, might make certain people irritated, even while it is usually minor. The inflammation can exacerbate illnesses like arthritis, which is more prevalent in older persons. For seniors, cutting back on or avoiding nightshades like bell peppers from their diet may help reduce joint pain and other inflammatory symptoms. Moderation and careful preparation are essential for seniors who like bell peppers. Bell peppers can become easier to stomach and less acidic by cooking. However, it might be preferable to stay away from them completely and replace them with less irritating veggies. If irritation or heartburn continue, another vegetable that appears healthful at first look is beets. But seniors may have issues with them, especially if they have certain health issues. Because beets are naturally high in sugar eating, too much of them can raise blood sugar levels. Beets might be a dangerous support for elderly people with diabetes or those who must regularly check their blood sugar levels, for those who have diabetes or insulin resistance. The high sugar content of beets may raise blood glucose levels, which could be harmful. Beets are high in oxalates, which are naturally occurring substances that, when present in high concentrations, can cause kidney stones. In addition to their sugar content, beets should be avoided or consumed in moderation by seniors who are at risk for kidney stones or who have already experienced kidney problems. For certain elderly, the hazards to kidney function may outweigh the health benefits of beets, such as increased blood flow and decreased blood pressure. Consuming beets in moderation and taking into account different preparation methods, such roasting or steaming, may help lower their glycemic index for seniors who still wish to benefit from their nutritious value. Another way to lessen the effect on blood sugar levels is to dilute beet juice with water or blend beets with other vegetables. In a mixed salad, Brussels sprouts belong to the same family of vegetables as cabbage, cauliflower, and broccoli. These veggies are praised for their high fiber content and ability to prevent cancer. Despite its nutritional value, Brussels sprouts can seriously upset older people's stomachs when combined with substances that contain sulfur. The high fiber level might cause indigestion, gas, and bloating. Certain foods, particularly those heavy in fiber, are more difficult for the body to digest as people age, because their digestive tracts tend to slow down. Brussels sprouts can make constipation and irritable bowel syndrome, IBS, worse for older adults who already suffer from these conditions when cooked. Brussels sprouts' sulfur components give them a strong fragrance and can cause the digestive tract to produce more gas. Seniors who wish to eat. Brussels sprouts should start with small servings and make sure they are cooked thoroughly, because cooking can help break down some of the sulfur and fiber elements. Brussels sprouts can cause some digestive discomfort, but this can be lessened by eating them alongside foods that are easy to digest, and by drinking lots of water, a popular vegetable in Southern and Creole. Cooking okra is prized for its high fiber content and mucilaginous texture, which can aid in thickening stews and soups. Okra, however, may cause digestive issues for elderly people. The fact that okra includes fructans, a form of carbohydrate that some individuals may find difficult to digest, is one of its primary problems. Bloating, gas, and other gastrointestinal discomforts can be brought on by fructans, particularly in people who are sensitive to this kind of carbohydrate. Furthermore, not everyone finds okra slimy texture, which results from its mucilage appealing. And some elderly people may find it challenging to chew and swallow. Okra may make it more difficult for elderly people with swallowing or chewing difficulties, such as those who have dysphagia or dentures. Additionally, okra has a lot of oxalates, which can make kidney stones more likely to form in people who are already at risk for them. It's crucial for seniors who like okra to eat it in moderation, and prepared as cooking can lessen some of its harmful effects. Green beans or zucchini, which are kinder to the stomach, can be better options if okra upsets your stomach. Many people herald garlic as a superfood because of its many health advantages, which include lowering blood pressure and strengthening the immune system. Garlic does have drawbacks, though particularly for elderly people. Garlic's ability to thin the blood is one of the main issues. Garlic can increase the risk of bleeding by intensifying the effects of anticoagulant drugs, like worsen seniors who are currently using blood thinners or who have medical issues that necessitate careful blood clot control, should be especially concerned about this. Garlic can induce gastrointestinal problems in certain elderly people. In addition to its interactions with medicines, eating a lot of raw garlic can cause upset stomach, acid reflux, and heartburn. This is due to the sulfur compounds found in garlic, which can irritate the stomach and esophageal lining and produce GERD symptoms. Moderation is essential for seniors who wish to eat garlic. Many of the health advantages of garlic can still be obtained when it is cooked, and it's generally less irritating to the digestive tract. However, before regularly consuming high amounts of garlic, people who are on blood thinners or who frequently get heartburn should speak with a healthcare professional because of their high lycopene content, which has been connected to a lower risk of heart disease and cancer. Tomatoes are a popular and adaptable component in many recipes. However, tomatoes can be problematic for elderly people, especially when they are cooked and used in soups and sauces. The high acidity of tomatoes can make diseases like GERD or acid reflux worse. When tomatoes are cooked, their acidity increasing. The likelihood that they will cause indigestion or heartburn in people with sensitive digestive systems. Additionally, tomatoes belong to the nightshade family, which includes bell peppers and may cause inflammation in certain people consuming tomatoes, especially in big quantities. May exacerbate the symptoms of arthritis or other inflammatory disorders in older adults. Less acidic types. Such yellow or orange, tomatoes can be an excellent substitute for seniors who like tomatoes but wish to prevent digestive issues. Heartburn risk can also be decreased by avoiding extremely concentrated types of tomatoes such as tomato paste and balancing them with non-acidic foods. A crisp and spicy vegetable radishes are frequently added to salads to give them a little more zing. Radishes, however, can be hard on the stomach, especially for elderly people. Radishes. Harsh taste is caused by substances that can irritate the stomach lining, causing bloating, gas, and upset stomach. Radishes. can make discomfort and irritation worse for elderly people with delicate digestive systems, or individuals with diseases like irritable bowel syndrome. IBS radishes have digestive benefits, but they also have diuretic properties, which means they make more urine. Consuming significant amounts of radishes may potentially disrupt fluid balance in the body for seniors with illnesses like kidney disease or those currently on diuretic drugs. Seniors who have digestive issues after eating radishes may want to reduce their consumption. Even if they can be enjoyed in moderation, radishes can be made simpler to digest and less harsh. By cooking them, seniors can also choose softer veggies, such as cucumbers, which offer a comparable crispness without irritating their digestive tracts. A leafy green vegetable chard is rich in minerals, including potassium and magnesium, as well as vitamins A, C, and K. Chard can be risky for elderly people, though especially because of its high oxalate level, as was previously discussed in relation to beets. And okra oxalates may help kidney stones form in people who are susceptible to kidney stones. Consuming a lot of chard may raise the risk of kidney stones in elder L. People with a history of kidney problems. Chard also contains a lot of vitamin K, which is important for blood coagulation. Although vitamin K is necessary for healthy bones and healthy blood coagulation, it may conflict with drugs that thin the blood to prevent issues with their prescription routine. Seniors taking anticoagulants should keep an eye on how much chard and other foods high in vitamin K they consume. Seniors who like leafy greens should limit their intake of chard and speak with their doctor if they are on any drugs that might interfere with the high vitamin content of the vegetable. Chard is a safer choice for people with kidney issues because cooking it can also help lower some of the oxalates due to their flavor and adaptability. Onions are a mainstay in many international cuisines. However, seniors, especially those with delicate digestive systems, may experience issues while eating raw onions. Sulfur chemicals found in onions can cause heartburn, bloating, and acid reflux. In addition to their strong flavor and perfume, raw onions can irritate the lining of the stomach, causing indigestion in certain people. Cutting out raw onions from their diet may aid seniors who suffer from GERD or other chronic stomach pain. Onions can be simpler to digest when cooked. But because of their high fiber content, some people may still experience bloating and gas. Seniors who suffer from these problems might choose to cut back on their onion intake or opt for less irritant varieties like shallots or green onions. Experimenting with different types and cooking techniques can help seniors who enjoy onions but wish to prevent intestinal discomfort. Onions can be made more palatable for sensitive digestive system by cooking them completely and serving them alongside other foods that don't irritate the stomach. Even though vegetables are a necessary component of a balanced diet, seniors should understand that not all veggies are created equal. Certain veggies can be more harmful than beneficial due to age-related changes in digestion, drug interactions, and the existence of chronic health conditions. These veggies can provide special dangers for older persons, from aggravating illnesses like kidney stones or arthritis to causing digestive problems. Seniors shouldn't completely eschew veggies. Though despite this, rather it's about making wise decisions and comprehending how different vegetables relate to their own health requirements. Seniors can have a healthy, balanced diet that promotes their well-being without needless problems if they know which veggies to avoid or eat in moderation. Seniors can get the most out of their nutrition while avoiding potential pitfalls by practicing portion control, careful preparation, and seeking advice from healthcare professionals. Making educated food choices is essential to preserving health and a high standard of living as one ages 9 vegetables. Seniors should think twice. Did you know that some vegetables in your fridge can harm your health? Especially if you are over 50. In a nutshell, here are 9 vegetables that seniors should avoid to protect their health. Surprising culprits like peppers, which can trigger acid reflux, and beetroot, which can raise blood sugar or lead to kidney problems, are just the start. others like okra and Brussel. Sprouts can cause bloating or worsen conditions, like arthritis and gout. Even popular choices like garlic and tomatoes can interact with medications or irritate digestion. While these vegetables have their benefits, seniors should consume. Resume them in moderation. Consider alternative cooking methods or replace them with gentler options such as zucchini or cucumber. This guide will help you make smarter dietary choices to improve your health watch to discover which vegetables to avoid and how you can stay healthier as you age. Music.